Timothy Allen, and today we're going to talk about opiate treatment during pregnancy. One of the common problems that I run into in my practice is women who are pregnant and also have some sort of an opiate use disorder. And the question is, how do we handle these things? How can we help people? And are there options available for that? Well, the first thing I want people to know is, yes, there are treatment options available, and there are good things that we can do to help a woman have a safe and healthy pregnancy. Whenever I have a woman who comes in to meet me for addiction, the first thing I want her to know is that I am not here to save her baby from her. I'm not here to condemn her. I'm here to try and treat her in the context of her pregnancy so that she can have a healthy pregnancy and a healthy child. My goal is to be supportive in this process, and I want my patients to do well. I have a very long track record of treating women who are pregnant with their addictions, and I've had very good success. I also maintain a practice where I see the children after delivery so that we can work together and try and break the cycle of addiction in families. And I've got a very good success rate at keeping women with their children after they have delivered as well. So, knowing that the purpose here is to have a healthy pregnancy and help women to get through this well and to be supportive of them, the first thing that we want to look at is, what is the danger in using opiates during pregnancy? Well, the biggest danger of using opiates during pregnancy is if someone is to use them inappropriately and they overdose and stop breathing, because that's bad for all parties involved. Obviously, we want to reduce the risk of death for mom and baby during the pregnancy, and the best thing I can do for that is to treat with either Suboxone or methadone. The next thing is trying to avoid withdrawal. Withdrawal can be very complicating in pregnancy, and so compared with not treating opiate use disorder during pregnancy and withdrawal, opiate treatment reduces the risk of miscarriage by about 80%. So that's a huge reduction as well. And so what we want to do is we want to make sure that we're treating people because it reduces the risk of mom dying, which therefore reduces the risk of baby dying as well. It also reduces the risk of miscarriage. So what we want to do is look at replacement. Now, there's two different types of medications that we use for opiate replacement or medication-assisted treatment in pregnancy. One is methadone and the other is Suboxone. Primarily, we would recommend Suboxone because Suboxone has less problems for the baby when the baby is born. Some children who have been in their mom while their mom is taking medication-assisted treatment may go through a period of what we call neonatal abstinence syndrome, where they may have to be treated with small doses of narcotics to help them to get off of those narcotics. Now, this is not very common in either case. Both Suboxone and methadone, about 10 to 15% of babies who are born require some sort of treatment for neonatal abstinence syndrome. The vast majority do not need any treatment with that at all. In addition to that, people who take Suboxone is clearly lower than methadone. Why would I choose methadone over Suboxone? Primarily for women who have been using a higher dose of opiates. As a general rule, Suboxone can cover about a gram of heroin use per day. If people are using more than a gram per day, generally I have to switch over to methadone. Methadone covers higher doses, and so in order to control someone's withdrawal symptoms and help them get through the pregnancy, we may need to switch to methadone. The other reason to switch to methadone is for people who are having lots of struggles with maintaining their sobriety, and if I give them a week or two of medications, they're unable to manage those and they need to have daily dosing and daily supervision. That would be a reason to do that. But the most important things that we look at here in terms of treatment is making sure that mom stays alive first, and then making sure that baby survives the pregnancy as well. Once we have done that with the Suboxone, we've got someone in a position where they're being supported and cared for, we look at what other benefits we have versus what other risks that we have. Well, the benefits are substantial. Women who are treated with Suboxone or methadone are less likely to get sexually transmitted diseases during pregnancy, which is good for everyone involved. They are also less likely to be arrested. They are less likely to go to jail. They're less likely to be involved in crime. They are more likely to maintain their employment. They are more likely to keep their children after the baby is born. Those are a lot of advantages that come from medication-assisted treatment. In addition to that, what I want to do when I'm treating anyone for opiate use disorder or any type of addiction, is to try and help people to come up with coping skills and ways to live that don't require the drugs. People use drugs for a reason. They're not just trying to mess themselves up. And certainly most women who I've taken care of with opiate use disorder were not trying to get pregnant. They're in a difficult situation, and I want to be as supportive as I can to try and help them to do well in these circumstances. So that involves things like treating anxiety, treating depression, treating bipolar disorder, helping people to have good coping skills, helping them to learn the skills that they need to be good parents. I do a lot of referring to crisis pregnant centers. We do a lot of work with trying to help people get their supplies and their planning. Learning how to be a good mom. A lot of these people have come from very difficult circumstances, and they didn't have a good role model to begin with, and so they need someone to help them along in that path. The most important thing, though, and once again I emphasize this, is my goal is to make sure that mom and baby stay alive. And medication-assisted treatment, Suboxone and methadone, make mom and baby more likely to survive. And then we can work and build on top of that. So if you have any questions about this, I'd be happy to see you in the office, or feel free to give us a call. Thank you very much.